All right. Well, I want to first thank everyone on behalf of InfoGPS and Etactics for attending today's webinar on overcoming the challenges of conducting a security risk analysis. Now, this is both a vast and complex topic that we're going to try and cram into 45 or 50 minutes of a presentation. So we're going to cover as much as possible and allow hopefully for a few minutes at the end of the presentation to address any questions that the audience might have. So please feel free to add any questions into the queue as they come up during the presentation. Now, also, we'll provide a list of answers to any questions that we're unable to address within that allotted time, so certainly don't hold them back. Now, before we get started with the presentation, I'd just like to introduce my co-host and featured speaker, Paul Hugenberg, the founder and CEO of InfoGPS Networks. Paul?
Well, good afternoon, everybody, and thank you for the introduction, Jay. Briefly, I won't go through everything here on the screen, but I've been in the information risk environment for about 25 years and have performed quite a few information risk assessments across various industries, and there's a lot of best practices and steps that are common between all of these exercises that hopefully we can address today to make this a challenge of completing the security risk analysis a much easier opportunity for you. So thanks again for taking the time to join and kind of listen to our approach. Kind of fit this into a picture. My company is InfoGPS, and we are working with K2 in the two biggest challenges for completing the SRA, and that is how do we document it, and the second being how do we collect a lot of the information that's required. And so the InfoGPS side of the house is really the technical aspect of collecting information off of your systems to help make this an easier process for you. So with that, I'm going to turn it back over to my co-presenter, Jay, back at you.
Thank you. Now, for those of you that don't know me, I am the Regional Sales and Product Manager for all Connect Plus powered solutions here at Etactics. Established in 1999 initially as a healthcare revenue cycle solutions vendor, the company has evolved over the years and currently serves over 4,000 clients in the healthcare, financial, and government sectors by providing them with innovative SaaS solutions tailored to their specific needs. This is actually my second stint with the company after taking a 3-year sabbatical to pursue a career in professional golf, which is a long story for another time. And most people don't return to a former place of employment after that kind of departure. And I think it certainly speaks very highly of the Etactics administration that A, I wanted to return to the company, and B, that I was afforded the opportunity to do so. But, enough about Paul and I, since that's obviously not why you're all in attendance today. Just want to provide you with a quick roadmap of what we're going to cover in today's presentation. I say we, but really what Paul is mostly going to cover, as he is the true subject matter expert. Anyways, we'll touch on why conducting a security risk analysis is required for most of you, address some of the challenges that organizations face trying to conduct them, and give some guidance on how to overcome those challenges. Talk about what are some of the best practices to help improve this entire process, as well as touch on some of the available resources to help you in the future when it's time to conduct a security risk analysis, while also improving your overall compliance efforts and documentation. Just a quick note, the information presented today is going to have a healthcare industry focus. However, conducting a security risk analysis is certainly not limited to the healthcare sector. They should really be conducted by all organizations that employ some type of information system, and have even the most rudimentary IT infrastructure. So don't feel discouraged if you're representing a non-healthcare organization. We appreciate your participation today. So in 2003, the security standards final rule was put into place and can be found in Title 45 of the Code of Federal Regulations, Parts 160, Subparts A and C of Part 164. Really, in layman's terms, what all that means is it basically states that as a healthcare entity, it's your responsibility to protect your patients' discrete or sensitive information. The digitization of this information, what is referred to today as electronic patient health information, or EPHI, led to quite a bit of concern on how this sensitive data was protected from outside vulnerabilities and threats. So implementing the HIPAA security rule provided healthcare organizations really with guidance on how to effectively protect their patients' information that's now in this electronic format. Well, part of that HIPAA security rule was that healthcare organizations need to assess their security measures against the standards set by the Office of Civil Rights, at minimum on a yearly basis. And this is the section of the rule that really gets most neglected, and I think why most of us are here today. So not only is conducting a security risk analysis a general mandate for all healthcare organizations, but this process is now a requirement for any participants in several government incentive programs, such as MIPS and meaningful use. So the days of kind of flying under the radar and ignoring this tedious and perhaps daunting task are kind of over. Now that there's really a threat in losing out on government funding or having already diminished reimbursement rates from some of these government entities garnished for failing to comply. Not to mention, there really aren't any medium to smaller size practices that would find it impossible to continue to exist after suffering the financial impacts of an OCR settlement that resulted from some type of a breach and lack of due diligence on their part. But not to worry, because Paul is here to help and talk about what some of those best practices are for conducting security risk analysis. So I'll turn things over to Paul.
Well, thank you again. So let's kind of get this ball rolling. One of the nice things about playing in the world that we play in is it becomes really quick and easy to look at current news to provide an illustration of why what we're going to be talking about is so important. So we put this presentation together. We've got some examples that we're going to go through that illustrate exactly how to address some issues and why they are concern to us. But before we start that, I think what I'll do is I'm going to spend about 30 seconds or so and talk about a current news story that reflects exactly what it is that we're talking about today. And by coincidence, a lot of the examples that we are going to go through are reflective in this news story as well. So if you take the opportunity today to go to Google or go to Fierce IT Healthcare News, go to Krebs Security, any of information you get for your security news. Hancock Health Systems is front and center over the past week, having announced a data breach. That data breach was the result of a ransomware infection. So a lesson here for us right off the bat as a best practice here. Ransomware with guidelines of the security rule is by default a breach, a reportable breach at that. So ransomware itself is a piece of malware. So Hancock Health Systems had introduced into its system a piece of malware that encrypted information across the network, about 1,400 files, as well as made unavailable certain patient applications for servicing clients and patients, and required a payment, in this case in Bitcoin, to receive the key to decrypt that information and continue business. So we have a introduction of malware created a ransomware event. By default, that's a reportable data breach that caused the organization to pay the offending hackers Bitcoin, in this case about $50,000 worth of Bitcoin, to receive the key. The organization itself decided it was easier to pay that ransomware than it was to recover or restore those applications and data from backup tapes. So we have introduction of malware, we have backup controls that are weak, and we also have the source of the breach was a third-party vendor that had administrative credentials to a Hancock Health Systems remote portal. So we have an outside party who wasn't controlling their information. It was stolen by a hacker and used to attack the hospital. That's exactly what we're trying to accomplish and understanding or awareness of when we do the assessment here. So we're going to talk about a couple of things as we move on from that example. What are the real-world drivers of this? There are different controls that the rule asks you to review and employ. Some of those are standard or required, and some of those are addressable, and we'll talk about the difference of those very, very quickly. And we're also going to review the complexity of the project ahead of you, the scope and how to scope this, what resources you may have inside already to begin to address this in an efficient way, and when maybe you need to kind of look to some outside help to get going. And then, of course, we'll revisit vendors specifically for the reason we just talked about in the Hancock example. We'll go over what we're testing, and we're going to start to talk the difference about threats and vulnerabilities, and then we'll kind of walk through understanding what we just did and what the SRA looks like when we're done. So the SRA, as a reminder, being that systems risk assessment. So what are the drivers that we have to deal with within the rule? And there are three drivers that we have to have right in front of us and we have to address as we go through this. One, and first, most importantly, is the patient. So this is the customers that you are dealing with or the customers of the doctors that you are receiving information from that have entrusted that organization with very personal information, quite identifiable, and information that they can be used to put that patient in a precarious position and or do things as basic as steal their identity, which in effect then will cause them some economic pain in the future. So we definitely here are recognizing that we are holding data that is not ours, that we are entrusted to hold and to protect. Unfortunately, the world is a rough place today in the digital space, and we are under constant attack by outside individuals and entities, sometimes nation states, who are trying to acquire that information for nefarious purposes. So make no mistake, our patients trust us and they expect us to put the proper controls in place to protect them. The second here is the doctor itself or the physician or the folks on the call, and that is the value of compliance. And that is in terms of, are we looking to make sure that we comply with a rule and recognize the benefits that it affords us in terms of expense to reacting to problems versus proactively addressing them, a very healthcare-oriented comment, right? And also in terms of, as JP mentioned, there are some government incentives that actually have monetized the necessity to perform this risk assessment and really give bonuses or benefits to people that do it very well. The third here, obviously, is enforcement or liability. So just to be clear before we go any further, if you are holding EPHI, you're required to do a security risk assessment by the rule, and it is a binary conclusion. Either it is done or it is not. And in the court of public opinion or in the court of liability, in the event that you suffer a breach and are brought in front of the legal system or the compliance arm, the OCR, the SRA is going to be something that is looked at first. And if it does not exist, there's a very real possibility that an organization will be found to not have addressed even the minimum reasonable standards to comply with the rule, and then liability goes up. Very briefly here, if you happen to be an organization that is participating in government programs and specifically the MIPS or meaningful use programs, the SRA itself provides you an ability to affect your reimbursement rates in a very positive way. And for those that say, maybe I really don't need to do this and I'm going to try to skirt by without it, affect your reimbursement rates in a very negative way. So just specifically for folks looking at the upcoming year, this requirement is due end of March. you're looking at the ability to earn up to about 10% in your reimbursement rates. For those that decide it is not important and they don't want to do it, you're looking at a real dollar amount loss of about 4% negative reimbursement rates. And those go up as the years go forward. So one of the nice things about the compliance rules, it provides folks a very quick and easy way to monetize a very good best practice of understanding what you have and protecting it anyways. It provides a nice value on the outside. So moving off from some of those drivers, we mentioned that we go over some required and addressable controls. So I'd like to address the two types of controls that you're going to be presented with when you start your security risk assessment. And we'll show you where you can review those real quick here on the K2 website, where we've put those for looking at in a very easy fashion. So there's two types. There are required security controls, and there are addressable security controls. These two words are kind of a misnomer. Every control, I believe there's 38 of them, are required for you to address. The difference between those tagged as required versus tagged as addressable relies only on this distinction. Those that are addressable, management must look at, must determine whether or not those are reasonable to implement within their environment, document that decision, especially if they choose not to implement that environment, and put that in their resultant system security plan for review on their next security risk assessment. So again, make no mistake, the controls required for us to look at are by the rule. You need to look at every one of them. You need to make an answer. Those that are listed as required, you have to implement. There are no choices. So very quickly, I'm just going to jump out to the K2 website. This link is in the slide deck that you'll be provided, and you'll see that there is a very easy to follow list of the controls that you must take a look at. And if you look at that middle column, you have a category that says required or addressable, and this is what I'm talking about. Those that do not have a tag in there would be considered the overriding standard. So think of the heading to the paragraph that introduces the topic. And so if we just take a really quick review of what this looks like, Section 164.308A1I, the very first line, says that we must have in our security management process policies and procedures to address security violations. The risk analysis line 2 says we must conduct a vulnerability assessment. If we scoot down to about middle of the page, we see that we have an addressable issue, the first one being, is there authorization or supervision for PAI access? So this would be an example of where you have the ability as an organization to say, this control, while it makes sense, is overburdensome, or the benefit of the control outweighs the risk. We have 2 people in the office. We do not need a policy that says these 2 people can look at EPHI. And so you're going to look at that inside and look for guidance if that is a question for you. So I'm just going to jump right back here to the presentation, but that list is available for you today on the K2 website, and it's also directly out of the security rule if you care to read that. So let's move on then to the complexity of what it is that we're going to be looking at, the scope, and what kind of internal resources that we're going to need. And we're going to look at a couple of things. One is skill, the time it takes to do this, the money it takes to do this, and whether or not we're using vendors. So skill is very specifically, do you have the internal resources that bring to bear IT, specifically IT risk or cybersecurity knowledge, to understand what the rule is asking you to do? An easy example of this would be the conducting of a vulnerability risk assessment or a vulnerability scan. If you have never run a vulnerability scan before, it's a very reasonable conclusion to say that the skills inside the organization to do that may not be sufficient to perform this test up to reasonable standards, and we need to look to an outside party to help do that. How does the tool run? What does it tell me when it's done? How do I respond to what the tool has told me is either a risk or is not a risk? Time is a very big factor for us. And matter of fact, if you just kind of take a look around your environment, you ought to allocate roughly, about a minimum of 40 hours or so just to do the assessment in any size office. And if you have 50 PCs or more, 50 devices or more in your office, it's going to roughly be about an hour per device to get an assessment done. So, a standard size office with a couple hundred machines, we're looking at a few weeks to kind of go through the process of getting an assessment done starting from scratch. Obviously, there's some resources that need to come into play in order to pay for that time and offer those skills. So be very aware that if you do not have those resources in-house, to kind of allocate that out of your budget. One of the nice things about that is generally professionals out in the partnership space are going to be very efficient at the process. And although it is an expense to do, weighing that against the potential benefits of greater reimbursement rates and the speed in which the engagement can be done is generally a pretty quick ROI. And then obviously, your vendors can help you with information as well, and be sure to contact them when you begin your systems risk assessment to let them know what is happening. The vendors are very important to you as well. And so we won't spend a whole lot of time on this slide because we spent a few minutes talk health systems, but very quickly, your insurance provider can begin to provide you with some information about how expensive these data breach events are, particularly when a systems risk assessment or security risk assessment has not been completed and the proper controls in place were not there to, one, prevent the breach, or the proper detective controls were not in place in order to recreate the breach and thus, minimize the expense to response by doing it very quickly. So in the case of Hancock, we're looking at a $30,000 or so Bitcoin payment. Depends on the day you price Bitcoin. You're also looking at the cost to respond to the breach in terms of restoration of systems and forensic response. And that can be several $1,000s a day to respond to these breaches. So be very aware of who your vendors are and utilize them heavily for gaining information about how they control their environment. So when you start to move on from understanding the time and effort it's going to take to get this done, really what we need to do now is start to understand what it is that we're going to test. So as I walk through this, reflect on the Hancock example. We're going to be testing our information system against the threats to EPHI, specifically in terms of their confidentiality, the integrity of the data, and its availability against vulnerabilities that we're concerned about. Those threats and vulnerabilities are going to be reviewed against a standard of controls, the security rule that JP mentioned at the beginning. And the result of that effort is going to be documented in a systems security risk assessment, which is a literal document, generally a spreadsheet-oriented document, and a systems security plan, which is generally a report or a set of findings based on an evaluation of all of those controls and a gap analysis. So we have a workflow here that we are going to start to walk through as we do this assessment. So let's define each one of those terms so that we know what we're dealing with. Simple, very similar to a patient or a healthcare system. The patient has a pulmonary system, a nervous system, various systems in the body that help the body perform certain tasks. Each of those systems is made up of various components. The respiratory system has lungs, it has a mouth, it has circulatory issues involved with it, it has a diaphragm. Your information system is very similar. It has components. Each one of these components is in scope. You have hardware, which you can pick up and feel and touch. These are your PCs, your laptops, your servers, your routers. These are the physical pieces of equipment you buy. You have software, which are like Word and Excel and your patient record systems, which store data. You have the people that access it, the data that is actually stored in that system, and then you have your policies. These 5 things are all part of the information system. So when we start to look at controls, every control is looked at across each of those 5 parts. And so when we start to look at those 5 parts, it becomes, a pretty heavy lift for us to start to talk about what all do I have to do. And so I'm going to present you here with what is an old tool used in the information risk practice, and this is called the Macumber's Cube. Looks like a Rubik's Cube, but this is very succinctly tells us, what we are looking to address. So if you notice, we have the confidentiality, integrity, and availability goals up at the top right. We're going to be looking across our organization for data that exists either at rest, is being sent from system to system, or is being processed today for different purposes, for CIA functionality. When we look at controls that we apply, we're going to be looking at 3 types of controls: administrative, physical, and technical controls. So we can look at each one of these boxes and say, I need to understand, do I have a technical control over data at rest to protect the confidentiality of my data? A simple math problem here shows us there's about 27 questions that we can ask ourselves to make sure that we're looking at our entire information system. And remember, there are 5 different things here we're going to be looking at. We're going to ask these 27 questions for hardware, 27 questions for people, 27 questions for software, and the like. So really quickly, since we're talking about data and the CIA, or confidentiality, integrity, availability over it, how do we talk about that in a sentence? What is a one sentence view of what it is that we are trying to accomplish? And it's very specific. We want to ensure that only those people who are authorized to see our patient data can trust the data when they see it, and can see it when they need to see it. Is it secret? Can they trust it? Is it true? And it is available when they need to see it. And everything that we're going to do around here kind of gets us to those answers. So the 3 types of controls, again, are the administrative controls, the physical controls, the technical controls, about 38 of those. And as a reminder, you need to do them all, but where they are marked addressable, let's take some time and talk about them as a management team, determine whether or not they are appropriate, and then document our reasons why. Where they are required, you just need to do it. An example of required would be, you have to have antivirus on a system. The addressable would be, does it need to be real time, right? And so we can kind of walk through those as a team and determine what it is that we want to be doing. As we kind of continue through this, then we begin to need to understand the difference between some of the terms we'll be using as we approach this process. And we mentioned before, we're going to be looking at vulnerabilities and threats over our information systems. So let's kind of talk about those really fast. A vulnerability is a weakness, and it's a weakness that can be exploited. An example of a weakness is, we do not require passwords to log into our systems. That in itself does not create a breach, but is certainly a weakness in your control structure that would allow a threat to access your systems in a much easier fashion. So another example of that would be unpatched systems. The use of personal devices to store patient data. Think of an iPad, or somebody taking a laptop and working from home. In the case of the Hancock system, it was unpatched event that allowed ransomware to be exploited. In this case, the threat is the danger that has the capability, the motivation, and or the intent to exploit the vulnerability. So the hacker exploited an unpatched system to deploy ransomware. The vulnerability was the unpatched system. The threat was the ransomware or the hacker. The result of that is a risk. And so when we're going to address risk, very specifically, we're going to walk through a calculation, and we're going to do this for every system that we have. And what we're going to do is ask ourselves to identify the likelihood of that threat exploiting a vulnerability. What's the probability? After we do that, we are going to assess, and again, this is an internal decision, what is the potential impact of that threat if it is exploited? And we can evaluate that based on privacy, CIA, revenue, reputation, but very specifically, it's a calculation. Likelihood times impact will give us a risk score. And what happens after we do that is we end up with a very clear method of prioritizing which systems represent our greatest risks, and we can evaluate those against the security rule controls and find our gaps at the end to address. This is a really quick example, and this is a one-line example in a spreadsheet. You'll likely have multiple spreadsheets. This is for an asset that we'll refer to as server A. So this is a piece of hardware. If we have 10 servers and they all do the same thing, they're kind of homogeneous, we can group these and call this servers. If we have servers that do very different things, we might have multiple line items, one for each. But we'll also have a spreadsheet here for applications. We'll have a spreadsheet for users as well. So in this example, and this reflects the Hancock event we talked about earlier, server A threat to server A is a malware infection. A vulnerability that exists on server A that threat can exploit can be outdated antivirus, lack of antivirus in its entirety, It can be the lack of real-time scanning. We can go through a list of these and evaluate the threat against that vulnerability and come up with a set of scores. In this case, we will indicate that with the outdated or lack of antivirus, the likelihood of getting an infection is high. As high as it can be, we're going to rate that as a 5. The impact of that, as we just saw with the Hancock environment, is very real. Can bring down systems, cost us money. We have to respond very, very quickly. The impact is equally high, rated as a 5. And our calculation here at the end is simple math. 5 times 5 equals 25. We do this over and over and over again, and it provides us a very nice numerical score to prioritize systems. You can score these any way you want. Your rankings for likelihood and impact can be anything you want. The secret is to consistently apply those. And in this case, you can see on the far right, we've started to understand what we can do to fill the gaps. These would be findings from the risk assessment that would be incorporated in the system security plan. Install real-time software, deny USBs, things like that. So basically what we're going to end up with is a nice chart across all of our systems that we can start to determine on a visual scale where most of our risks are associated. And in this chart, we begin to plot our systems. So in the prior example you saw, we ranked with a 25. We would have our server A as one of the first things that we would begin to address. This is a very quick process once you get the scores done, and it's consistent and it's understood, and it provides us a nice way to walk through the system. So as a revisit here and just kind of a stop and think about what we just went over, we've got 5 information systems. We've got about 27 or so questions that we need to ask about each of those 5 information systems. In an environment where every day we hear about new threats, where there's news about vulnerabilities that we have to look at in terms of our own internal structure, and we have to evaluate all of those against these security rules, this required and addressable set of 36 security controls that we feel are the minimum that we need to address to protect the EPHI in our system. And we have to do this at least once a year. It happens more if you make major changes, but this is a fairly large lift to do your first time through. So there's a couple of things that we'd like to see happen as we go through this, and one is the process creates a set of documentation that is updatable so that we don't have to recreate it again, preferably in a software type of format. And there's a plan of action for gaps that we, again, can use some sort of automation to track it through its plan of actions for gaps. So what we want to do now is begin to understand what you may have already done inside to begin to address these issues. So really quickly, do you have policies and procedures? Have you already done that? If not, let's take a look at them, see where there's gaps. Do you employ or perform end user training so folks are aware of your expectations? If you do not, start. If you need help starting, ask a resource to kind of help you get through that, and I can lead you in a direction to do that. Technical aspects, very easy to perform. A lot of times it's misunderstood what they do, but if you are already requiring passwords, if you do employ encryption, if you're using an antivirus, document that stuff right away. Gives a good set of steps forward, to start the process at sea instead of starting the process, earlier at A from the beginning. And then data and asset discovery. One of the things that we hear every time we walk into an organization, a very consistent concern is we really don't know what types of systems may or may not be attaching to our network. We don't know if there's an iPad plugging in. We don't know if we got rid of software. We don't know if we pulled an old system, an old laptop off the network. So we need something to help identify that. And we really struggle with even inventorying where our EPHI is. So using tools to automate that become very, very helpful. So you can use technology to create these types of information in a very quick and comprehensive fashion. So again, grab all that stuff and put it together, and then let's get moving. And what the work that you can perform early is work that saves folks like myself from recreating that manually, gives us a great step forward. Last but not least, once you do the SRA, are you done? Unfortunately not. The SRA, the security risk assessment, is meant to help you understand your current state, to prioritize where you have gaps, where you are not meeting compliance requirements, or where you are, but you still feel like you are accepting too much risk. And the result of those decisions then gets incorporated into a system security plan. Remember, the security plan is binary. Either you have it or you do not. And once it is created, it becomes a document that you need to follow all the way through its disposition. So what I'll do right now is I'm not going to go through a software package with you, but I will show you an example of where you can use a tool to very quickly isolate the controls that you require. That's the middle of this screen. And test those. Assign those to somebody to review, assign their due dates to review them and put in their information. And now this information is here and it can be revisited in the future going forward. Instead of recreating spreadsheets, we're trying to remember what you answered in a last exam. The production of your security plan, obviously off of this, becomes now much easier. It becomes automated, and the content of how these plans are built can be put together in a very, very nice fashion that is, 1, easily understood, 2, drives compliance, and 3, rolls everything up in a nice fashion that we can begin to report up to management or to our examiners as to what's going on. So with that, you've listened to my voice for quite a while. I'm going to stop for a minute, turn it back over to JP to talk about how we overcome some of these challenges.
Great. So, Paul, you obviously talked quite a bit about what goes into conducting an SRA and what are some of those challenges that you need to get over in terms of conducting that SRA. So, how do you overcome these challenges? We've got a few recommendations for you that also tie into some of the best practices that we'll also discuss here. Well, one is, first, take an inventory of your available resources, manpower, and any types of tools that you may have at your disposal. Ask yourself, is conducting a security risk analysis something that you're going to be able to allocate the time and resources to? That's one question that you're going to want to ask yourself. Okay, do you or someone at the organization possess the subject matter expertise to appropriately perform and manage the entire SRA process? If not, it's probably time to find somebody that does have both the time and the knowledge to help out with this process. Next, it's important to create detailed lists of information system components and areas that are going to need to be addressed while conducting the analysis. And then finally, you need to understand that this is and should be an ongoing process throughout the year. Your policies need to be consistently updated, monitored to make sure that they're being enacted throughout the organization. This really isn't a task that you're going to want to scramble at the last minute to gather information, and update that information that you've gathered. It's really a full-time gig to manage the entire project. So for many organizations that don't have someone dedicated to keeping up with this year-round, it's okay, because there is help to be had out there in the forms of consultants and some of the automated tools that are available. I mentioned that ongoing documentation and management is really a year-round project, and it first kind of starts with sitting down with the organization's stakeholders and vetting out what your current and future concerns and threats are. The next thing you're going to want to do is start to store and create a list of your assets. So start with any devices that have access to your network. Here's an example of a list of company devices with pertinent information about those devices that's stored inside of our K2 compliance application. Each device or asset is going to have its own unique record in the system that can be tracked and updated in an ongoing basis. Next, in terms of creating my list or adding to my list of assets, I want to include software applications and a list of application users or asset owners. Having a tool that allows applications, devices, and users to all be related to one another is going to make managing this list and keeping it up to date a lot easier for you. Auditors don't want a jumble of spreadsheets, Word docs, or even written notes as evidence that this information is being appropriately managed and updated. So if you can incorporate some type of technology for the next time that you go through an assessment or audit or security risk analysis, that's going to give you the ability to provide an updated list of those assets that need to be evaluated by the click of a few buttons. Next is keep track of all of the vendors that you work and share data with. Paul talked about several of the important aspects of understanding that you are not only at risk internally, but with those vendor relationships that you have, and it's important to assess those relationships for potential risks to your organization. So storing a list of vendors, just like your assets, allows an organization to manage those relationships. It has stored pertinent vendor information that's going to be easily accessible, and then document that communication with the vendor, especially in the event of some type of a security breach between either entity. Now, the next two items are probably the most important on this list, starting with the storing of your policies and procedures, providing access to them and really understanding what they mean. Many organizations struggle identifying where their policies even exist, let alone what they actually mean. So the first thing to do is locate those policies and then store them in some type of a central location like the one I'm showing. Next is to be able to link the policies to their respective procedures. And this is where you kind of start to understand what those policies and individual segments mean. We've actually developed a method inside of our K2 compliance application that we call our policy navigator. Now, this view allows us to take a policy, break it down to the most granular level, and then from here, organizations can access the individual policy segments, link those segments to their respective mandates and requirements. That could be HIPAA, NIST, and after all, there's typically a reason or rationale for having these policies, just aside from best business practice. These policies really come from the HIPAA laws or the various frameworks like NIST and PCI. Linking the two together is going to provide the organization with an ongoing gap analysis so that they know what parts of the rules that they still need to address and continue to address. Now, putting a policy in this type of a dynamic format also allows for us to link activities pertaining to the policies and can then be managed and documented in an ongoing basis. So here I can also see, in addition to the policy that this procedure spawns from, an activity surrounding that procedure, but I can also see in this case that this procedure links to the access control family, the control AC1 policies and procedures. So I can see that relationship all within one central arena. Now, the second part is to, and maybe the final piece here, is having access to the actual regulations and legal obligations that your organization needs to adhere to. So we've actually taken a similar approach with these frameworks or regulations that we did with the policies and stored them in a dynamic kind of navigator view. So I can go in and select a specific framework or regulation that I want to look at, and I can access the most granular level of that framework, map it to my policies, and then see what parts of the regulations I still need to address or map out. Now, in this format, assessment and audit projects can also be performed just by selecting the individual framework components that I need to include in my evaluation. So I understand that this is a fairly dry topic we've been covering today. And we're probably to the point where most folks are looking at their watches, wondering when we're going to get to the end. So to kind of liven everything up, I'm going to ask a friend of mine to help me address really a major issue here. Yes, it is the Stay Puft Marshmallow Man who is going to represent this big problem. And that is many organizations are unaware and have no idea of what their biggest risk is until it's right in front of them. So, Paul, as an organization that might not be prepared to face these risks, really until they're unveiled in front of them, how can we address this matter in sort of a triage approach?
Yeah, so thank you, Jay. So I think this is kind of, a good segue into, a lot of times we don't understand what our biggest threat is until we go through the process of evaluating us in a very deliberate fashion. So once we've, created those lists and began to understand what our environment is from an asset standpoint, let's go through this process in a pretty deliberate fashion, which will let us kind of tick things off without kind of getting into the weeds until it's necessary. So one, let's all agree on what the threats and vulnerabilities are to our information systems. The easiest example that I can give at the moment is in Northeast Ohio, I'm not too worried about a hurricane hitting my data center. In Miami, I'm very worried about it. It is a realistic threat. So we have to understand that we're not chasing down threats that may not necessarily be relevant to us. So let's agree on that list and make sure that it's manageable. Once we have those threats, it's a fairly simple process then to understand what vulnerabilities will allow those threats to be exploited. If I'm worried about antivirus and malware, a vulnerability is not having an antivirus or malware solution, and I can fix that pretty fast. Step two, look at all of the assets in our information systems, those 5 components, and identify 2 very specific things. Are they significant to our business from an operational standpoint? Would their loss be a hurdle that we would struggle to overcome? And 2, do they contain EPHI or hold patient data? Based on those 2 things, let's evaluate the risk, assign an impact score, a likelihood score of the threat against those assets that we agreed upon a minute ago. And the mathematical result of that is going to be a very easy way for us to prioritize our high risk systems and vulnerabilities from our moderate risk systems and vulnerabilities from our low. So let's start with our high. After we've done this, let's get these out of the way. Take our high risk systems, let's segment those off and document against the standard those 37 or 38 required controls, and let's mark them off and evidence that those are in place. Any gaps, let's kick them over to our system security plan so that we can mark them for disposition and filling them out through completion. After that's done, let's repeat this process for the moderate risks. We've got the high risks done. Now let's go to moderate. When those are done, let's move on to the low. The importance of going through it in this fashion is there is going to become a point where the effort to continue to secure lower risk systems, the cost of that outweighs the benefit. Only you know that inside your organization, and only you can document why that is the case. And often the help of an outside consultant can get you there in a faster fashion. So high risks, moderate risks, then let's address our low risk systems or assets. And then finally, where our risk rank addressable controls are reviewed, make sure we document what is going to be put in place versus what we determine may or may not be relevant for our environment, and get those over to the system security plan so that we can address the gaps. The last thing that you want to make sure that you do when overcoming the challenges of completing the SRA is you've gone through all of this work, and now we need to make sure that we do something about it. So very specifically set due dates to anything that you have found in the system that you wish to be improved. I have a draft policy. It needs to go to the board. This is the date. We have antivirus not found on 22 servers. We will implement that on 22 servers by this date. And this is the person that is responsible for ensuring that it is happening, and then document that process. It's very easy to do that in a system, but at the very least, make sure everything you have has a due date and a person assigned to fix it, and make sure that they do. The second is you're going through a pretty heavy lift effort here, as we said. Make sure the processes that you're putting in place really are processes. They are ongoing and they are repeatable, so that when we look at these things again in the future, we are not recreating everything from scratch. Jay?
Great. So, Paul, and everyone, as I mentioned in our last segment, and I've already introduced some best practices for conducting security risk analysis, just want to briefly harp on a couple more. Ongoing compliance, documentation, and consistent monitoring are really what InfoGPS and Etactics have focused our recent efforts on in the compliance realm. Just want to ask you, think long and hard about how you document your compliance efforts today. If I asked you to provide me with a detailed report of those efforts, how long would it take for you to gather this information? A day, a week, maybe a month? What kinds of tools are at your disposal to help these documentation efforts? Excel, Word, Outlook, calendar really aren't going to be enough to get the job done at this point. And if that's all you're doing now, it's probably time for you to start thinking about implementing a technology and resource that can not only be tailored but scaled down to fit your specific needs, and it's going to allow you to document those ongoing efforts and relate them to specific policy segments that fulfill those government mandates and requirements. And most of all, make this information easy to navigate and access. And that's kind of been the Etactics focus. Paul's company, InfoGPS, really relates to the consistent monitoring piece. And Paul, if you wanted to just briefly touch on how that focus really aligns with InfoGPS.
Absolutely. So very quickly, the approach you take to doing this really is going to play well in terms of the next steps of this ongoing process for you. So again, ensure you use tools where they're available. InfoGPS is one tool out of a toolbox of many that can be used to satisfy different portions of your control risk environment. And then once you identify those tools and you've established a process to document what it is that you're doing, your risk assessment will help you identify the frequency of updates, whether that's daily, monthly, quarterly, or on an annual basis.
So, Paul, we've all heard rumors or myths kind of floating around out there concerning security risk analyses. How about just addressing some of the big ones for all of our attendees?
Very good. So I'm going to address kind of two out of the list here, and the top two big ones that we see. The first one is, am I too small for this requirement? And the answer to that is an unequivocal no. If you are storing EPHI, you have requirements and responsibility to your patients to store that data in a secured fashion, understand who you are sharing it with, when and how it is secured. In the event of a breach, it is your breach. It is not the breach of the vendor that may have lost it. This is your responsibility. So absolutely, if you have information inside, very basic steps are required and they can be handled in a reasonable fashion. The second is, the second biggest would be my vendor handled this. And this is I can tell you as a prior CIO for an organization, if my vendor lost my customer's data, my customers still yell at me. And the regulators do too. So your vendors are your responsibility. There are very specific steps for due diligence that we can walk you through to understand how they secure their data. But by no means can you avoid taking responsibility for the people you choose to do business with that help you with storing and processing your patient's data.
So I think the important thing for everyone to know is that you're not alone. In response to dealing with that big problem that we've kind of talked about and that many healthcare organizations face, I just want to quickly introduce another character, Winston Zeddemore of the Ghostbusters, who really has a great quote in the movie. While they're at the top of this skyscraper trying to figure out how to save New York City from the evil inhabitants, he proclaims to his team that we have the tools and we have the talent. Well, that's a message that I'd like to share with everyone in attendance today. You're going to be left alone to deal with the HIPAA security rule and conduct a proper security risk analysis. No, you're not. InfoGPS and Etactics have teamed up together to provide our current clients and other healthcare organizations with a unique solution we call our Access Program. Now, our Access Program, it can be scaled down to meet the unique needs for each organization. So whether you kind of need the complete package, you want to outsource or need help from kind of start to finish, or you're just looking for some ways to improve your ongoing compliance and documentation efforts, thus making life much easier the next time you go through this process, our Access Program is really going to be the resource that we encourage you to explore. So for more information on our Access Program, please visit our website listed on this slide or contact me directly. And don't worry about scrambling to write down this information. As I mentioned before, we'll be sending each attendee a copy of the webinar, slide share presentation as well. So I know we're pretty much at the end of our allotted time here, but I did want to at least open the floor up for any questions that we can quickly attend to. And as mentioned, if we don't get to them all, we'll certainly provide everyone with a list of those questions and the answers. So the first question is, are there any physical tools or resources required to be installed on, their network to identify stored EPHI? If so, how does that work? And Paul, I'll kind of let you address that first one.
Absolutely. So it's a two-part question. Yes, you are required to inventory your EPHI assets, classify systems based on the amount and type of EPHI systems, and then employ controls. That can be done in an audit style fashion where a scanning tool is used to answer that question. For larger, I guess that's a bad example, large organizations, but those that have an ongoing governance desire then would physically install a tool on the machine to continue to watch it, much like you would antivirus. So yes, you're required to do it. No, it doesn't have to be installed full time, but your security requirements may desire that.
So another question we have is whether or not we'll be doing another webinar on this subject, and want their administrator to be able to see it. We try to do a webinar regarding some type of a compliance topic every couple of months. But in this regards, we, as mentioned, will be sending out a copy of this webinar, the recording piece, as well as the accompanied slide share to everyone who attended. So you can certainly share this with any other team members at the organization. Well, everyone, we've reached our allotted time and want to, again, thank everyone for attending. Got a couple more questions here that we'll certainly put together in a list and accompany the answers to those questions with the copy of the slide share and presentation that you get today. So we'll certainly address those. And as mentioned, just wanted to thank everyone for attending today, and hope, like I said, reach out to us if you'd like some more information on our Access Program or have any other questions that you'd like to address with us regarding the topics discussed today. So thank you, everyone, and enjoy the rest of your day.
Thank you, everybody.